What's up, AT Farm? Nick Novak out here, Scottsdale, Arizona, out west. It is approximately 67 degrees. We're right by the pool, and it is a perfect time to learn about some pharmacology. Specifically, we're going to discuss NSAIDs today. NSAIDs stand for non-steroidal anti-inflammatory drugs. We use these quite often in the athletic training domain, purposely for, of course, combating some pain, but more so combating swelling and trying to promote the getting rid of swelling throughout the body and reducing that so our athletes can have a better range of motion and that they can perform at a greater level. All right, so we're going to dig into some fun facts, discuss how NSAIDs work, primarily just a couple of them, give you some actual examples of NSAIDs that we use within our domain, and then we'll hit you up with a couple more athletic training tips along the way. So first fun fact is aspirin is a type of NSAID. Mom's staring at me, 1 second. All right, sorry about that. I'm gonna dig back in here to aspirin. Last year, aspirin alone accounted for over 10,000 tons of production. That means 10,000 tons of aspirin were made in 1 year for the United States, purposely to decrease swelling throughout the body. Now, the way that aspirin works or the way that NSAIDs work is they primarily go for and target the PGs. Now, the PGs are chemotoxic receivers. My mistake. It is not chemical receivers, they're chemical mediators. So PGs are chemical mediators, and the purpose that they serve in the body is that they increase vascular permeability, and chemotaxis induces pain, suppresses some aspects of inflammation. So basically, this is the body's mechanism in which it starts to cause the swelling. What we don't want as athletic trainers, it gets in the joint space and it reduces our range of motion and increases pain. NSAIDs target just that. So the PGs are targeted and they start to decrease in order to decrease some of the swelling, decrease the permeability, get those chemotaxis out of there, start flush out the system. So overall, there are over 20 types of NSAIDs, but today we're going to dig into just a couple. The ones that are most commonly known in the athletic training domain, especially in the Millikan athletic training room that we see and hear a lot about, are aspirin and ibuprofen. Aspirin has its own name brand and can also be found in different trade names and generic names, as well as ibuprofen, which are commonly seen as Advil or other drugs of such nature, but they also have their generic name that can be sold for a lot cheaper also. All right, so now we're going to dig in a little bit to how NSAIDs work in the form of administering them or taking them. So most NSAIDs are only taken orally, meaning they come in either a capsule or a tablet and have to be swallowed. Then going down the GI tract, which then can cause some disruption, some upset stomach, some upset GI system, all those symptoms that come with that. We'll talk about that a little bit later. But so they go down, they're metabolized. Most NSAIDs will attach to the plasma proteins. They will bind to those, and then they will try to attack the CNS to promote the vascular and permeability to decrease, therefore getting some of the swelling out of the system. Along with that, we need to metabolize or absorb the drug, which is done by the liver. After the liver absorbs that, secretes it, it is excreted back out through urine. So that's how the body ends up getting rid of the NSAID. All right, so we all know that, your ibuprofen, your aspirin, they're located at any store you want to go to. If you need it, they got it. They really doesn't take too much to purchase. It's not like a prescription medication. Simple OTC, you can buy it. They don't really track how many people are buying it and how much dosage. Really, it's easily accessible, and therefore that causes a lot of issues in the United States. So many, in fact, that over 16,000 patients die from adverse effects, and over 100,000 patients alone are hospitalized. A main reason for this is because, like I said, it's not a prescription drug. Therefore, a lot of people don't realize how impactful it can be on the human body because it is so easily accessible, and that so many people seem to take it due to pain and also inflammation reasoning. All right, so some of the adverse effects of NSAIDs are, we discussed one earlier, that by being GI irritation, because it goes right down orally and through your GI system. Other symptoms and adverse effects consist of heartburn, nausea, upper GI bleeding, and gastric and duodenal ulcers or related complications, including perforation, bleeding obstruction, and death. We don't want any of that. Now, we've already said it a couple times, but gastric irritation is probably the most common adverse reaction due to NSAIDs So some tips in order to decrease the likelihood of our athlete taking that is to ensure that they are on a full stomach, being both hydrated as well as have the proper nutrients within their body so that they can properly absorb it and not have any irritation along the way of that drug being absorbed throughout the body. All right, so another thing that we have to be cognitive of, be very aware of, is the fact that we should not, as athletic trainers, be, well, one, we don't administer, but we could incentivize or lead our athletes in the right direction. But if we're treating in regards to the high school domain, the middle school domain, or any athlete within that field, that while we're working youth athletics, we have to be very careful to make sure that our athletes are not taking aspirin, especially if they're 19 years or younger, according to the book, and running a fever. This is due to Ray's syndrome. Ray's syndrome consists of simply death. Unfortunately, if our athletes are at a young age and they're taking aspirin, that could have some adverse reactions and therefore an overall promote or cause death for our athlete, and that is not something that we want to have at all. Therefore, with that being said, aspirin cannot be used, but other drugs such as acetaminophen and ibuprofen can, and they can promote this same goal in which we wanted. So stay away from the aspirin. We don't want death, and go to something like ibuprofen or acetaminophen, but also watch over them as they take that. Make sure that they're on a full stomach so there's no GI disruption, and also make sure that the parents know and are aware that the young athletes are taking drugs of that nature. All right, so we're just about finishing up here. We're going to touch on a few key concepts and roles in the athletic training domain, and then I'm jumping in the pool. So let's dig in. The role of the athletic trainer, we have to make sure that the benefits outweigh the adverse effects, and that we are truly, if we're giving our patient Advil, ibuprofen, aspirin, that is in their best interest and at their best for their best health. Also, NSAID should not be taken, like we just talked about, on a empty stomach. That means both hydrated and with proper nutrition, so that way it can absorb and cause no GI disruption, because if we have an athlete with GI disruption, they're not going to perform well, if at all, and that depletes the whole purpose of trying to get them up to playing level. Only one NSAID should be taken at a time, meaning we should not be mixing Tylenol and Advil or anything like that. Now, there are things that talk about where you can cross over here or there, especially after surgery, because they're made up of different chemical compounds, but that should only be done if prescribed by a doctor, and we should not, as athletic trainers, be telling our athletes to do that. Also, we need to monitor the long-term and also the dosing of drugs such as NSAIDs, commonly that we see a lot with football players, basketball players, even soccer players, anybody with contact, is that they rely heavily on the fact that they want to stay away from pain or swelling, so they just take Advil after Advil and popping pills before practice, and eventually they build up a tolerance and they want to use it more and more. Well, we want to steer them away from that, because they're just going to affect their liver even more, because that's where it all gets metabolized, and they can actually cause more harm in the long term than they can for the short term, that they're trying to deplete their pain or swelling. And finally, not that we see it too often, but since it is out there, in the use of elderly and pregnant women, NSAIDs should be highly not encouraged. We should try and stay away from them, and stay that way it doesn't disrupt the fetus. And also in the elderly respond differently, especially with a weakened, or not necessarily a weakened, but not as efficient GI system, which could cause more ulceration with that stomach lining, and overall just keeping them safe. So in that case, we want to try and talk to a doctor at that point if they're having issues, refer them properly, and go from there, because that is not in our scope of practice. And overall, that is it. I got all my facts from good old Holgum's book today, so properly cite that. And as for that, I am going in the pool. So you guys have a great weekend. See you next week.